Today we cure about 95% of all testicular cancer patients. That's thanks to cisplatin-based chemotherapy that was discovered 40 years ago, and now today we would expect a survivor to live for over 40 years once they're cured from their disease. That being said, they are at risk for long-term complications from chemotherapy, and one of those complications is hypogonadism, or low testosterone levels. And so the Platinum study is a National Cancer Institute funded study. It's a multi-institution study of cancer centers in North America and Canada. And what it's doing, it's trying to understand why these complications happen, how prevalent are they, and how to mitigate some of these problems. And so in this study, we enrolled over 1,600 patients so far. The data that we're presenting today is from the first 491 survivors, and of those survivors, 38% had low testosterone levels. And what we found actually is those survivors with low testosterone levels were almost 3 times more likely to have high blood pressure and twice more likely to have high cholesterol, high diabetes, and erectile dysfunction. They were also more likely to take medications for depression and anxiety. And so what we would recommend is that healthcare providers that see these survivors screen for hypogonadism, ask them about the symptoms for hypogonadism, and if they do have those symptoms, then measure their testosterone levels and replace them with testosterone therapy if they are low.
And what kind of predisposing factors might there be for developing hypogonadism?
And so what we found in this study is that as these survivors age, and then their risk of hypogonadism increases, and the more obese they were also more likely to have low testosterone levels.
Okay. So going forwards, lifestyle management, looking at diet and exercise would be a possible course?
So absolutely, we always recommend that our survivors maintain a healthy weight and exercise and watch their diet.
Okay. And in a near or distant future, looking at new therapies, different therapies for treating testicular cancer, if cisplatin is the main source of this hypogonadism, would alternative therapies be a way of mitigating that risk as well?
I really doubt so. We've been looking for 40 years now for another therapy, and those 5% of survivors who don't respond to cisplatin, there's not much out there that can help them. It's not impossible, but I think we're stuck with cisplatin for a long time. It's a very good drug. It treats 95% of them. So.